Diabetes is a life-threatening medical condition in which the blood sugar levels are unusually high. Most people are of the opinion that diabetes is a life-limiting medical condition, but this is absolutely untrue. It is possible for diabetics to lead a fulfilling life, as long as they adhere to specific essential dietary restrictions. What a sufferer eats when diagnosed with any diabetic condition, may it be pre-diabetes, full-blown diabetes, or otherwise directly influences blood sugar levels. No wonder, it can rightly be said that sensible food choices go a long way in keeping a fleet of health complications associated with diabetes miles away. When it comes to keeping pre-diabetes condition in check, all types of fruits and vegetables come in handy. Being rich in both minerals and essential vitamins, they form an inseparable part of a pre-diabetic diet. Basically, foods high in carbohydrates essentially elevate the blood sugar levels. Complex carbohydrate foods suddenly increase blood sugar when eaten in excess. The starch in them easily gets converted into sugars when they get ingested, leading to an instant rise in blood sugar levels. This being so, one should ensure that daily meals should only comprise of a small percentage of complex carbohydrates. Typically, a pre-diabetic diet is recommended to contain only 45-75 grams of any type of a carbohydrate per serving. Both fruits and vegetables should be served more as opposed to other helpings. When it comes to selecting the best fruits for a pre-diabetic victim, one should choose those that are low in sugars. Whatever fruit that is selected, ensure that it is low in carbohydrates. The selected fruits should not have more than 15 grams of carbohydrates per serving. Some examples of fruits that are recommended to be included in a pre-diabetic diet includes all types of citrus fruits, grapefruits, apples, peaches, and blackberries. However, strawberries, though classified as low-sugared fruits, should not be overeaten as they are high in carbohydrate contents. For example, 180 grams of strawberries 1 1/4 cup contain 15 grams of carbohydrates. Consuming more than this amount leads to an increased levels of blood sugar, which is bad for diabetic patients. Apart from the fruits, a recent study shows that an increased consumption of vegetables significantly reduces the chances of developing full-blown diabetes. This clearly shows the benefits associated with daily vegetable intake in the control of diabetes. Furthermore, vegetables are a poor source of complex carbohydrates and have compounds that assist to improve the blood sugar levels, thus should generously be included in the daily diet. Tomatoes and onions are especially low in carbohydrates and should be included in a pre-diabetic diet on a regular basis. Actually, most of the green leafy vegetables not only alleviate the pre-diabetes risk, but can also contribute in its management. These are such as spinach, cauliflower, lettuce, lady's finger, cabbage, broccoli, kale, mustard, turnip, greens, and bitter gourd, or what is generally known as bitter melon. All in all, in order to combat pre-diabetes or a full-scale diabetic medical condition, one should follow a daily physical exercises routine, besides the healthy diet. 40 minutes of brisk walking may actually benefit the sufferer in managing their diabetic condition effectively. Basically, a light exercises routine after lunch and dinner is actually a natural way of regulating the patient's blood sugar levels. If you want to reverse your pre-diabetes or diabetes with a 100% natural program, I leave the video link below in the description about the program that is changing the lives of many people.